This is a video tour of the esophagus stomach. This specimen is a longitudinal section through the junction between the esophagus and the stomach. And the blue arrows here are actually marking that junction. So on the left is esophagus and on the right is the stomach. Now you're going to see two places where there's a junction, and that's just due to the fact that the junction is very undulated, or let's say serrated. So that's why you're seeing in one section two junction areas. If you had a really ideal section, you would see the esophagus here, and then it would change right to the stomach, or like up here, and that was all you would see. And of course the stomach has a muscular wall, and that's between the two dotted lines here on this annotation. And the box is actually guiding you to an area where the gastric glands are very well presented. So let's just zoom in on that junction. Now it's very abrupt. Let's see. I guess up here would be okay. It changes immediately, even though there's a little bit of a tear, an artifact here, between the stratified squamous non-keratinized epithelium, which is the typical normal lining of the esophagus, to the simple columnar cells that line the stomach. I will probably maybe reduce the size of this arrow, or maybe just leave it alone. It's a pretty good indication of the junction at low and high magnification. I think I'll just leave it as it is. So your job is to understand the layers of the esophagus, where you can see here the epithelium and then the connective tissue, and then under that you actually have smooth muscle cells that are, and that's what these are here. You see that the nuclei are within the acidophilic cytoplasm. That's how you tell the smooth muscle from connective tissue, because fibroblast cells lie on to the side of a collagen. So this is the muscularis mucosa of the esophagus. And then I think if we zoom out over here, you're beginning to see here a little better rendition of the muscularis mucosa here, and then as you zoom out you will see the muscularis externa of the esophagus. Now when you look at these, you can see that all of the smooth muscle cells are cut in cross section here, and that's because this is the circular layer, and the outer layer of the muscularis externa, the fibers run longitudinally. So this is a longitudinal section, so it cut those smooth muscle cells in parallel, and the inner circular layer, it cut it in cross section. And of course that's the way you can tell whether you have a longitudinal section or a cross section of any part of the GI tract. So again, here is the junction. We saw that, and right at the junction you have cardiac glands of the stomach, which have a lot of mucus cells, and as we move here, now you have a more typical lining of the stomach where you have the gastric pits, and some of the epithelial cells are destroyed and sloughed off in this specimen, so it's not really complete. But if we move over to this area that we have recommend you study, for the most part the epithelial cells are intact, maybe right at the surface. In some cases here they go along the edge. Now notice all these cells are producing mucus, but yet they are not the typical goblet shaped cells, so that we don't call these goblet cells. These are just mucus, simple columnar cells secreting mucus on into the lumen of the stomach. Okay, so and then down here you've got the gastric glands, where you can see a mixture of the pepsinogen secreting cells that are basophilic, and the reddish cells that are parietal cells. So I think that that's perhaps enough orientation for you to be able to study this esophagus specimen. Remember to correlate what you're learning in a lecture with this lab specimen and the web mic specimens to put the whole story together of the esophagus and the stomach.